question, at least the last part, that I think is very important, and I welcome the opportunity to address this. The idea about the doses that would be available, you know, a couple of 100 million doses in the beginning of the year, some companies saying that in a couple of years, a year or two, they'll have as many as 1 billion doses. I think that's real. Most people would raise their eyebrows and think that how is that going to happen? And it is because things are being done at risk. Companies are starting to plan to make doses even before you know the vaccine works. So the risk of the speed is not risk to safety, it's not risk to scientific integrity, it's risk to money. So put that aside. The point that Congressman Upton made, I think is very important. We need to be careful that we don't jump because of our need to get vaccines for those who need it, that we do not definitively prove safety and efficacy before we make decisions about distribution. We've heard a lot about emergency use authorization. An emergency use authorization is important, but it has to be done in a situation where you fulfill the criteria for the emergency use authorization. I would be very disappointed if we jumped to a conclusion before we knew that a vaccine was truly safe and truly effective, because I wouldn't want the perpetual ambiguity of not knowing whether or not it is truly safe and truly effective. That's the reason why we're doing several randomized placebo-controlled trials with power enough that could give us that answer. I hope that answers your question, Fred.
Well, just one quick, what would be the earliest that you think, under the best scenario, that we might be able to see an EUA issued by you all, along with, I guess it would actually be the FDA, right, that would actually issue that?
Yes, the answer is yes. Let me just quickly answer that and hand it over to Steve, because he may want to answer that. We're going into the first phase 3 efficacy trial in July. It takes at least a month to get to the second dose because it's a prime boost. You'll take another couple of months to accrue or enroll enough people that if there is viral activity in the community, and we have our sites not only in the United States, but all over the world, in Brazil and in South Africa. So if we get an efficacy signal, you're going to get an efficacy signal more quickly the more cases there are. Now, if it turns out that there are not a lot of cases, it may take longer. And that's the reason why you can't give an accurate prediction of when you're going to get those data. Steve, you want to take it from here?
Yeah, thanks, Dr. Fauci. So just a couple of issues to your point, Congressman Upton. One is we are working with sponsors across the board, private industry, Operation Warp Speed, et cetera, those who are developing vaccines, and we're providing technical assistance regarding clinical trial design, the number of participants in the clinical trials, as well as the endpoints that we want to see to make an adjudication about safety and effectiveness. And I want to emphasize what Dr. Fauci said, and that is the acceleration is really around taking financial risk around the development process. The acceleration is not cutting corners with respect to the assessment of safety and effectiveness. The American people can rely upon the fact that FDA has many experts in the vaccine area. We've been doing this for years, and we will rely upon the science and data when it's available to us to make that adjudication and decision regarding an EUA. I cannot prejudge when that will happen.
Thank you, Fred. Next, we have the gentlewoman from California, Ms. Eshoo.
Thank you, Mr. Chairman, and good morning, everyone. I'd like to start with Dr. Redfield. Doctor, we had a conversation on the weekend, and I expressed to you really my dismay, my disappointment about you as CDC director, the most prestigious institution in the world on infectious diseases and prevention. The United States today is number one in the world in infections and in deaths. This is not anything that any of us can be proud of. The American people are in pain, they're grieving, there's a great deal of sorrow in communities, there's confusion because for many reasons. And I urged you, as head of CDC, to speak directly to the American people. I know the agencies are talking to each other. I consider that a whisper because the American people are not hearing you speak out. They deserve to hear the truth. We have heard Dr. Fauci time and time again putting out trusted information to the American people. The American people are divided on this issue of the virus. Imagine that. So I continue to urge you to speak out. You're a doctor. Put your white jacket on and speak weekly to the American people. They want to know what's coming, what is ahead. My constituents ask me on a consistent basis, what's next? What is our government doing? That's a haunting question. And so while we're doing the nice back and forth this morning, good questions on the part of members, I really remain dismayed and deeply disappointed. We need leadership coming out of the CDC, real leadership. It was an outrage that there was a gathering in Tulsa. 6 of the president's advanced people were infected. And it's my understanding the 2 Secret Service agents were. How can the CDC allow this pandemic, this virus, to be something political? You have to push back. You're a scientist, you're a doctor. Now to Dr. Hahn, I'm sure you've read the several articles regarding hydroxychloroquine. Every study states it doesn't work in any setting. In fact, it has known side effects, cardiac issues being one. So there's a danger in terms of the side effects. As commissioner, you see all the data. Are you going to inform the American people, doctors across the country about these facts?
Thank you, Congresswoman, for that question. And indeed, we are. I can refer the committee to several documents that we have put out over the last several weeks regarding hydroxychloroquine. With respect to the issues, we issued a safety alert, particularly around the combination of hydroxychloroquine with other drugs that might affect the heart. And as you know, we've taken recent action regarding the EUA.
Have you specifically spoken directly to the American people so there isn't this confusion about hydroxychloroquine?
Yes, ma'am. There is an FDA Voices piece that's authored by me, as well as a piece that's directly to the American people about the status of hydroxychloroquine.
That's on paper. I want to know if you have spoken out verbally to the American people, to doctors across the country. People don't hear paper, with all due respect.
Yes, ma'am, and I appreciate the question, but every opportunity I've had to be in the media, I've been asked that question, and I have communicated that same information about the current status.
I have another question, Dr. Hahn. There have been several disturbing articles expressing concerns relative to political pressure being placed on the FDA by the White House. Will you state unequivocally that if any political pressure is applied to you and the FDA, that you will immediately report that to this committee?
I will certainly unequivocally state that if I receive political pressure, I will report this committee. I can tell you that I have not felt political pressure, nor has the FDA, to make any decision in any specific direction.
Thank you.
Well, it's not about feelings. It's about a direct political pressure. So thank you for your response and back.
Thank you, Ms. Eshu. Next is Mr. Lauda from Ohio.
Well, thank you, Mr. Chairman, and thanks to our witnesses and all the hard work that you've been doing over the last several months for not only the United States, but for individuals from around the world. Greatly appreciate it. Dr. Fauci, if I could start my questions with you. And I know that our leader, Mr. Walden, had brought some of this up. Would you further explain how an infected individual develops antibodies and how long those antibodies remain effective in fighting off the virus? And are you seeing different levels of antibodies in people who have been infected and what that means in terms of immunity?
Thank you very much for that question, Congressman Latta. So we need to start off by saying that we want to assume you're dealing with an antibody test that's been validated by the FDA or by the NIH. That's important because a lot of the confusion out there are tests that are not validated. But let's assume you have a good test. Whenever the body gets confronted with a virus and recovers, even when they don't recover, the body is stimulated to make antibodies. In general, for viruses that we have a lot of experience with, those antibodies serve to protect you against exposure and infection after you're exposed to the same virus. So that's what we call immunological memory, and these proteins block the virus. The one thing we do not know yet with COVID-19 is the relationship between the type of antibody, because the best antibody is called neutralizing antibody. Namely, if this were the virus, and this is where the virus binds to the cell, the neutralizing antibody blocks the virus from binding to the cell. There are antibodies against other parts of the virus that are called binding antibodies. They don't mean much. So you got to make sure you get the right antibody. The second thing is, what we still don't know is what the relationship between the titer of the antibody is, namely the level of the antibody, and the degree of protection. The third thing we don't know is how long or what the duration of that antibody is going to be. We're going to find these things out as we study these individuals over months and a year or more. But remember, we're only a few months into this. So A, we know they make antibody. B, it's likely that they're protected for some period of time, but we don't know how long that's going to be. So the question I always get asked, which is a subtext, does that mean if you're exposed and you have antibody that you're protected? Likely you are, but we don't know how long you are protected.
All right, well, thank you.